Hi, welcome back to Patient Conversations with Leah. Today we're hearing from Heather. This is our third episode of our series with her. She was diagnosed at 36 years old with ALK positive stage 4 lung cancer in June of 2020 at the height of the pandemic. So if you missed her first and second episodes, they were great. The first one was about her diagnosis. The second one was about dating as a young cancer patient. And today on this episode, I would love to delve into her relationship with her family, and how lung cancer is affecting her family today, and since diagnosis. So Heather, if you'd like to share with us just a little bit about your family dynamics and what's going on in the lung cancer world in your family.
Again, I was diagnosed in June of 2020. I was very fortunate because I had actually just moved states. I had moved from Texas to New Mexico in 2019. And so with that move, I was now closer to my parents. They're only about an hour away from me now. So I was so fortunate, so thankful that I had made that move when I was diagnosed, especially with COVID going on. And I remember whenever I was in the hospital, I was very fortunate because, again, during COVID times, they actually were not allowing patients to have visitors in the hospital. And I was there for a month. I was so ill that they were willing to make an exception for me. I was allowed to have one person in the room with me per 24-hour period. And so my mom, my dad, my fiance at the time, they would all take turns switching off. And I remember having a conversation with my dad while I was in the hospital and just processing this devastating news of lung cancer together. And I remember him telling me if he could take it away from me, he would. I'm going to get emotional.
Take your time. It's okay.
I told him that I did not want that. I would not want that. Fast forward, my dad went in to have something unrelated, like he had a preventative heart scan. And they came back and they told him, your heart looks fine, but you have some nodes in your lungs. This was back in 2020, probably around June or July. And they said we need to do a further workup. He followed up. He had some scans. He actually had a PET scan, and the PET scan, it didn't show like as if it was cancerous. So they just said it's not cancer. Like we just need to keep watching it. So every 3 months or every 6 months, he would go in and have a CT scan to see if the nodules were changing at all. And he actually did that for 3 years, and they never changed over these 3 years until they did. And then in November of 2023, finally, one of the nodes slightly grew, minimally, just millimeters, and he actually developed new nodes. So by that point, they said, okay, we need to look this up further. And unfortunately, his care was mismanaged as well. He was kind of just sent all over the place. There was no follow through. Everybody was taking forever to get him in for things. And he was actually affected by a cyber attack. The healthcare facility he was going to had like a cyber attack to where it completely locked the providers out of the healthcare records. So that also delayed his care. But finally, he was diagnosed with lung cancer himself. We thought we caught it early because we had been watching it all that time and the nodes had just minimally grown. We kind of were given like the options of you can do chemotherapy and then have surgery, or you can do surgery, then have chemotherapy. We decided to go to a lung cancer specialty center in Colorado. So that's where we went. They actually did genetic testing for him too. So my dad was also a non-smoker. He never smoked. He was pretty healthy. They also did the molecular testing for my dad. And strangely enough, my dad actually came back with EGFR mutation, whereas I have the ALK mutation. So it's just very bizarre that we would both have lung cancer and different mutations. So going back, we were in Colorado. We decided to pursue surgery first, followed by chemotherapy. He ended up having his right middle lobe removed. And it's so frustrating because leading up to his surgery, just everything was just taking so long. It'd be like weeks in between appointments and scans. And I just remember questioning them every single time, like, why is this taking so long? And we need to hurry up. They would all just kind of just write us off and say, don't worry, don't worry. Well, by the time he had his surgery, which was in January, so he was diagnosed in November with the EGFR cancer. He had his lobectomy in January of 2024, and he was already a stage 3B. So the doctor started removing these lymph nodes, and I think they removed 21 lymph nodes, and I want to say 19 of those came back positive. So he was much further along, than anybody had suspected, but it really didn't change his plan. So we had the lobectomy, they got it all out, and we came home. He did 4 rounds of chemotherapy and is now on Tagrisso. So he's considered no evidence of disease right now as well. And he's doing really well. He's recovered great from his lobectomy, and he's tolerating the Tagrisso really well overall. But it's been tough because of everything I've been through. I'm grateful that I was able to kind of help navigate and guide him on the things we need to know and ask and make sure are being done because we've already been there with me. But it's also been hard because I feel like, of course, I don't think any parent wants to put any kind of burden on their kid, but he doesn't really like complain about things to me because he knows like what I went through. So he doesn't feel, I guess, his is as bad, for lack of a better way to say it. And I'm just like, everything you're going through is just as valid as what I'm going through. So it's been tough. I feel really bad for my mom, my poor mom, just having to deal with the stress between my diagnosis and now my dad's diagnosis. And just even though we're doing well, there's always scans, there's always labs, there's always that fear underlying of it coming back. So we just all kind of live with that stress.
That is crazy. I mean, what are the odds? What are the odds that the two of you would both have lung cancer, late stage lung cancer diagnosis is 2 different mutations? For those that are listening and watching, can you kind of explain? I know people are wondering if this means this is a hereditary thing, or if there's a reason, if something caused you both to have lung cancer.
No, actually, it is not. It is not considered hereditary. It is kind of tricky, and I don't know as much about the science side of this part. So I'm not going to explain it very well, but I think they call it like a somatic mutation, where even though it's genetic, I know when people hear genetic, they think like that means it's hereditary, it's passed down, but genetic does not mean that. Genetic just is a gene, right? So basically, it's just something happened to our genes. They don't know why. They don't know what caused it. There's theories and speculations out there. I personally think possible air pollution. We lived in Dallas, and so possible air pollution, or maybe one of the homes we lived in with the radon. I don't know. We moved quite a bit, so it's hard to kind of backtrack and figure that out. So no, it is not hereditary. In fact, my oncologist, we both have the same oncologist. We go to the same oncologist. And she tested right away because she had already been caring for me. So as soon as my dad got this diagnosis, she said, we need to look into this. So she sent off for the hereditary genetic type mutations, and we were negative for all of them. So it's definitely not hereditary. It's just some weird fluke thing that just happened to cause a, flip of a switch in our genes. And it just happened to affect different genes. Mine was like an ALK rearrangement. And then his is this exon 19 deletion is the one he has for the EGFR. So totally not related, totally random.
I mean, I'm speechless almost. Like, what are the odds? I just can't imagine. And, I think I've talked to people about, your cancer diagnosis isn't just your own. It affects everyone that loves you and cares for you. Yes, there's certain parts of it that are your own. Like no one can feel physically exactly how you're feeling, or even, emotionally or mentally what you're feeling. But I think it's interesting that you point out as a parent, you feel like your dad doesn't really share all of this, maybe what he's going through to protect you. Probably as a parent, you would want nothing more than to, when your child's hurt or sick or upset, to take that away. And your dad's saying, if I could take it from you, I would. My mom has said the same thing. My dad has said the same thing. I would say the same thing to my children. Do you feel like with him having this diagnosis, does it make it easier for you to share how you're feeling and what you're going through with him? Or does it make it harder? Has it changed your relationship at all?
I don't think it's changed our relationship. It's funny because I've gone to several of his appointments. Again, I shared before I work in the healthcare field, so I have a better understanding of some of the medical terminology and lingo and how the system works. It's funny because I've accompanied him to a few of his oncology appointments, and my mom made the joke, like, I think she thinks she's our parent now. Because I just show up and I'm like, okay. And I start asking all the questions and grilling the oncologist because I want to make sure that he's getting the right care that he deserves. Because unfortunately, I know unless you advocate for yourself, you can fall through the cracks. So that's kind of a funny thing we've joked about. But no, I think for the most part, I'm pretty open with things that are going on with them. Yeah, I don't really think that it prevents me from sharing or anything like that. But um I think we just all understand, like we get it because, like the other, so I have a new scare going on right now. I just had a PET scan recently and I have a new nodule showing up on my thyroid. So I'm having to get all that followed up. Just talking with my parents about this and how I'm feeling and just how it was triggering for me. It brought me back right to that ultrasound of my mass on my clavicle. Even though it's more than likely nothing. I'm going to tell myself it's more than likely nothing. It's triggering. And my dad's, was able to say, I understand. I get it because he's been there now. I think it's made us closer on that level of, unless you're truly going through it, I don't think you can really fully understand and relate.
That's pretty, oh, I hate to hear about the thyroid thing, but yes, I'm
Yeah.
going to say it's nothing as well until you hear otherwise, right?
Thank you.
But I think it's pretty amazing that you all are having this experience kind of like parallels, and you do really understand. There's probably a deeper level of connection there than we think, definitely on the understanding part. But I think it's interesting too that you said, you were the one that would go to the appointments with him because that's what you would have done if you didn't have your diagnosis. And I'm sure there's things he does for you the same way he would have done them and did do them before he got his own diagnosis. Just
Yeah,
you and I and him as well have learned you do have to advocate and you do have to, you know, be there for the people that you care for. My mom is a nurse and she's retired, but still anybody in our family, anytime somebody gets sick and needs to go to the doctor, they take her with them or they, have her listen because she does understand that. It's interesting that just to point out that although this is a terrible situation with both of you having this late stage lung cancer, still just you're doing your normal thing, like taking care of your dad. Lung cancer is crazy because for the first time in a long time, or ever really in lung cancer, we're living longer, we're younger, we're taking in this information. And, you're not only caring for but you're also caring for your parents. And many of us are also caring for children. So it's like this multi-layered caring and kind of trying to meet the needs of everybody. So I'm sure that can be heavy at times as well.
absolutely.
Well, I really appreciate you being here and sharing that part of your story. I don't think I've met another lung cancer patient whose parent or child has lung cancer as well. So that's a first. But I do appreciate you sharing this with us and kind of just letting us in on how this affects just more than yourself and one aspect of your life. Before we say goodbye, I didn't know if there was any last minute thoughts or ideas that you'd like to share with the rest of us.
For me personally, it's like lung cancer has been life-changing, of course, in so many different ways. And for those who are newly diagnosed, it's a dark time, but it can get better. It does get better over time. I just really encourage you to seek out mental health care. That was huge for me. I started talk therapy. I really started practicing mindfulness and just trying to live in the moment and not let the fear of the unknowns control my life and how I live. Because in all reality, like none of us really know what's going to happen in the next 5 minutes or tomorrow. Even though you do have this big, heavy cloud hanging over you, if you can try to work through it, you can still live a really fulfilling, joyful life. But you've got to put in some work and it's going to take some time to process everything. But hang in there because it does get better.
I think that's great advice. Yes, I like that. Like it is heavy and it is hard, but like you said earlier, cancer is not who you are. It doesn't define you. It's just part of you. And kind of have to live our lives that way too. Like it's not our entire life. It can be all consuming at times, but um, it does get better. And it's an up and down every day, every minute,
All the
every
time,
month.
even 5 years in. It happens, but you just can't linger there. You got to kind of feel the feels, work it out however you need to work it out, and then keep your head up and go out there and enjoy your life. If you're just constantly overwhelmed by it and angry or sad or grieving, it's not living. So that's the choice I've made anyways, is, I'm not going to let the fear of the unknowns or just this thing control my every moment. Like I still want to live and I still want to enjoy myself and have fun. And that's what life is about to me. So that's the choice I'm making.
Well, I think you're a great example and role model of living life with this terminal diagnosis because it is about living. So I really, really appreciate you being here today and sharing your story with us. It's been just eye-opening, and I encourage you, if you're watching this and you haven't seen parts one and two, you should definitely tune in. So thank you very much for being here.
Thank you for having me, Leah. Thanks for the opportunity.